Before surgery, when did you first start experiencing problems in your day-to-day life?
Everything seemed to happen after I turned 50 and went downhill, and gradually all my joints seemed to be reacting. I couldn't really, at the very end, lift my arms above my shoulders to put a shirt on. I used to actually bend down in order to pull a shirt over my head and into my arms. I couldn't pick cables up. I couldn't even move a chair around my desk. There were various other things. I couldn't lie on my left side in bed. Very painful. So I had to lie on my back on my right side, and even my right side, which they did first. It was very, very difficult. And many a time I did sit up in bed and go to sleep. A good 10 years ago, after that I had joints in by another surgeon, which never really worked. However, it did give me a slight better movement.
We recently spoke to Mr. Lowe. Can you explain the diagnosis process?
Trevor had painful stiff shoulders in the late 2000s, and the vogue at that time was for surface replacement arthroplasty in this country. He had bilateral surface replacement arthroplasties towards the end of the 2000s, and they lasted very well, and for the first 5 or 6 years were functioning well with little discomfort and good functional outcomes. But it became obvious over time that his shoulders were becoming more stiff, more painful, and X-ray changes over time indicated significant glenoid erosion.
What was the right solution for him in the end?
Trevor's bony deformity was so severe that it became obvious that a custom implant was the most appropriate way forward from the outset. In order to achieve a stable glenoid fixation with the joint space at the right level, it became clear that a custom implant was appropriate. When ProMade came along, we were able to use that technology to utilise the bone that's present and fill defects with the metal and with the trabecular titanium technology.
What distinguishes ProMade from other options?
ProMade is really for significant defects. We can adapt the prosthesis to the bone that's available, and we can think outside the normal box of a normal base plate.
What improvements did you first notice, and how has this impacted on your life?
I could put my shirt on without bending down. I can shower without like curling up and trying to get into these the nether regions, if you want. I could lie on my left side in bed. Same when I had my right side done, I could lie on my right side in bed, because I've had them both done. My life actually changed. Not just for the good, for the better for everybody. If Mr. Bale was sat here now, the first thing I'd say to him is thank you. I've said it before and I'll say it again, thank you, thank you. You've changed my life.